So my name is Rob Wiebe, and I'm going to tell you a little story about my journey with cancer. About March or April of 2010, I was in one of my favorite places in the mountains with some friends, and I kind of lost my voice. Now, I'd had a cold and a few things happening at that point, and I thought, oh great, I have laryngitis. So over the next week or week and a half, I tried to treat it with different cups of tea and honey and goodies like that. And it wasn't going away. And classically, you get a little bit of a swelling on the glands in here when you have some kind of infection happening. So I didn't really think too much of it, but the swelling wasn't going down and my voice wasn't coming back. And the swelling on the left side of my face was getting larger, just to the point where it actually eclipsed the back of the tip of my jaw. Put your finger on the edge of your jaw there. Now you should be able to feel it. Well, I couldn't feel it on this side. There's this little kind of a swelling growing. Then I started looking for a doctor. Well, my doctor retired a few years ago and I didn't have a family GP. So I tried to go to one of the clinics in town, and they have this system where you kind of line up, and if you get now calling number 411, well, you know you're not going to get in. So I tried it twice and I couldn't get in. I didn't get up early enough, didn't get to the front of the line. And my wife was looking at my neck and she said, we better go to the doctor. I said, yeah, I've been trying. So we ended up going to a clinic in Beaver Lodge, and I was able to get in. The doctor took a look at my throat, decided he would give me some antibiotics just in case, but he also wanted to get me a test or I guess a sample or a CT scan, because he said there was something happening with my tonsil. So we booked it, went to the doctor that week at the hospital, had a CT scan, and about 4 days after that he called me and he said, I want you to see a specialist. And I went to see a doctor at the hospital who said he'd squeeze me in during his lunch hour. And at this point, the lump was kind of growing, and it was quite large. And of course, my voice and my mouth and my tongue were all doing strange things. And he decided at that point that he wanted to do some biopsies right away. So he took a little fancy machine and he snapped a couple of points right through into the lump. And he wasn't going to waste any time. He already booked me for the University Hospital to see a special surgeon there for a cancer treatment. Now at this point, I didn't know that I had a cancer, and I didn't know what was happening. We booked in, I'm thinking it was early June. I spent 9 days at the University Hospital, not because I had to be there, but the doctor booked me in, felt that if I was in the hospital, they could do all the tests that they wanted, and if something opened up for an MRI, I would get in. So by about the 4th day, I had an MRI, I was in, had my checkup, everything was done. I must have had blood tests, CT scans, MRIs, a head MRI, and then I had the big consult. The comment was, yes, the biopsy is back. We confirm it's a type of cancer. The CT scan shows that you have a cancerous tumor on the left, on top of the left node of your lymphatic node, and you have another smaller tumor on the right-hand side, and a tumor that had started in the the right tonsil. Well, you can imagine it kind of sets you back a little bit when this happens. I had my wife with me, and we were kind of in shock, but they said that they would set me up immediately with the Cross Cancer Clinic. So the afternoon before I was released from the University Hospital, I had a consult with an oncologist at the University Hospital, and she said that we would be arranging to have both chemo and radiation set up within about 3 to 4 weeks. So things were starting to happen very quickly. At the end of July, I checked in, or I shouldn't say I checked in, we moved to Edmonton for what we thought was a 6 or 7 week period. And I commenced chemo on one day, and I started my radiation the same day. Now here's the story. I started my chemo, basically I had 3 shots. The first one, I kind of sat around for 3 or 4 hours with a whole bunch of bags of these chemicals running into my arm. And that morning I'd also had basically a 6-minute shot of radiation. And it's called beam radiation. We're very lucky in Alberta to have these machines, which are quite modern. In the old days, when you were dealing with cancer, they used to radiate with a beam all the way around, and you'd burn things out all the way through here. For me, the beam it fired specifically at the cancers because they put me in a little CT scanner machine, which also was the beam tomography machine. So I went in for about 6 minutes lying flat with this mask on my head, holding my head straight. If you're claustrophobic, it kind of has an impact on you. I lay there waiting for the first 6 minutes as the CT scan basically checked out where all the tumors were, just to confirm that they were there. Came back out, waited for a few seconds. The radiologist and oncologist were setting up I guess it's the dosage on the machine. And then I went right back into this machine laying down, and it fired at me for about 6 minutes. I could kind of hear this thing humming around my head as it spins. So basically you're laying inside this huge donut, and it's going bing, bing, bing as the chain's running around your head, firing. Well, we went to all the workshops and all the events that happened before that to warn you about what's happening. But truthfully, I didn't remember a lot of this stuff. And my wife took some notes, and I took a few notes, and it doesn't really prepare you for what happens. I started blogging about it on my Facebook page, telling people what was happening, because I did hear from somebody that I was dying. Well, that may be true, but I also wanted to get it out there to say, hey, it was therapeutic for me to tell people what was going on. And somewhere at the back of my mind, I realized it also helped other people who were going through the same thing or had loved ones or friends, relatives, everything like that going through it. So the voyage began. Radiation is cumulative, so the effects is cumulative. So for 6 weeks, basically, I think 36 doses of radiation. I got Saturday and Sunday and holidays off. But by the middle of the second week, I was sleeping most of the day. Oh, I forgot to tell you this. They also put a feeding tube into my stomach because they warned me that I wouldn't be able to eat, which is quite true, because the stuff burned your throat because the radiation was firing at my tonsil. As it spun through, there was some residual impact from the radiation on my tongue because it was firing into the tumors on both sides. So, week 2, I'm sleeping a lot. My wife was quite worried until she talked to a fellow sitting beside me in the clinic who's confirmed that, oh yeah, his wife was getting treated and she slept most of the time after having been radiated. They don't tell you this. Well, maybe they did, we just forgot. But once she learned that, she felt a little bit more comfortable, and then those 6 weeks became a bit of a holiday for her because she read a bunch of books, she stayed with me, she made sure that my feeding tube was clean and that, I mean, I was really out of it. She made sure that that I was eating, basically. They put me on a special diet of this solution. It's like Ensure, but twice as concentrated. I was basically eating 6,000 calories a day, and I was still losing weight. Basically, my body was fighting the effects of the cancer, the radiation, and the chemo. At about week 3 or 4, from what I can recall, the doctors had me come in for a special CT scan. We did another check, and they confirmed that the radiation was having an impact on the tumors. They were shrinking. Now, I had a panic attack at one point because they wanted me to change my mask. Now, if you've ever had one of these masks put on, what they do is they bring you in. It's a kind of a soft plastic fiberglass kind of thing, and they soak it in warm water, and then they lay it over your face for a couple of minutes so that it solidifies to your neck and your head. I didn't want to go through that again, so I thought, well, is there some way they could just keep the original mask? And they checked it, they did the measurements, and they agreed, yeah, we can keep the original one. Good, because they'd already cut little holes in it so I could look out, and a little thing around my mouth so I could kind of feel like I was breathing. Mostly psychological, because I was feeling quite claustrophobic in this thing. It's literally, when they put this mask on you and they lay you back in the machine, they actually pin your head down with these plastic snaps to keep your head in place. And that's pretty claustrophobic inducing. Anyway, back to the story. I carried on with this stuff. For 6 weeks, we lived in Edmonton. I might have to digress a little bit. I technically became unemployed. My wife had to take time off of work. We had to dip into our savings to pay for a residence for 6 weeks in Edmonton. They told us some interesting things like, oh, you know, you might be able to get this subsidized. Well, no, our income from the both of us was over the minimum level that would allow us to get any kind of subsidy. So then they said, well, you can claim it back. Yeah, you still have to pay for it up front. And then we did try to claim it back on income tax. Funny thing is, you only get to get about a third of it back, because the rest of it is deducted in strange ways. Anyway, that's a nasty part of the story. So I carried on 6 weeks. The end of, I guess about the first week of September, second week of September, we had my last chemo and finished with my radiation. And the third chemo was probably the worst one in terms of impact. I didn't really feel anything, but certain things were happening to me. I lost the peripheral feeling in my fingers and toes, which, if I jump forward a couple of months, I realized I can't play guitar, I can't do some of the things I used to do. Sometimes have trouble even doing up buttons. Now, I'll go back a couple of months, just remember that I was one of those classic people that was basically healthy, had a cold once in a while, never really set foot in the hospital, hadn't been ill. And I had been in weight training for years. I was fairly physically fit, maybe overweight, but physically fit. And I lost roughly 65, 70 pounds. So I went from about 240 down to between 165 and 170. Right now I'm at a stable 175. The good news is I'm not really at risk for diabetes anymore. Anyway. So at the end, this was in 2012. So September 2012, I came out of treatment. The radiation had taken care of most of the tumor, and they were pretty sure that they'd gotten it. They didn't think that I'd even have to do surgery to get rid of the tumors, which was good news. The effects of chemo were interesting because what chemo does is it knocks out your immune system for a cycle. So let's say it's a 28-day cycle. Your immunity drops down to 0 at about the middle of the cycle and slowly builds back up again. So at that point where it's down to 0, you avoid people, you don't go to stores, you don't go to restaurants. I couldn't eat anything anyway, but you get the drift. So probably the end of October, I kind of woke up, because chemo leaves you in a bit of a fog. I was scheduled for a CT scan. The CT scan showed that there was no further cancer in my throat, in my neck. However, there was some damage. The one tumor had done some damage to the nerve, which, if I show you my fingers, is the vocal cords. This one's firing great, and this one, the nerve was cut, and it fires sporadically. It also affects my tongue, and you'll notice just a little bit of a droop in my left eye. My vision is fine because that nerve wasn't touched, but the part that covers your face was touched. And it drops, when I get tired, it drops further down and it makes me feel kind of funny. Well, they weren't sure whether the nerves would come back, and I'm pretty sure they're not going to come back. So I still have a hoarse voice. I won't be doing too much oration in big groups anymore unless I have a good microphone. If I get tired, my tongue also doesn't work properly because the nerves to one side are kind of damaged. Some of it's from the tumor cutting the nerve, and some of it may still be from the radiation. Now, some people, depending on where the tumors are, the radiation still affects your saliva glands. Now, I had not very much saliva for about 5 or 6 months, and it started coming back. I still only have about half the saliva being generated of what I would normally get. It only allows me to eat certain things or have to make sure I drink something like milk with everything that I'm eating to help swallow. It's an ongoing process. Now, a year ago, so this would be December of 2013, I had another scan. Now what they were doing is scanning me every 4 to 6 months. And the scan discovered 4 spots in my right lung. They're very small, like 2 millimeters, and the largest being 16 milliliters. And they were still growing. So now this cancer, which isn't a common cancer, has now become what we call lung cancer. Funny thing about cancer, it doesn't matter where it starts. Where it ends up is what becomes the next term. So if you had cancer of the skin, it was skin cancer, but it may metastasize to the lung, then it becomes lung cancer. So as of this point, I'm positive for lung cancer. I'm on what I call the 4-month plan. Every 4 months I go in and get a scan for a CT or a CT scan to see what's happening with the cancer. Almost a year's gone by. Now I'm finding that we are debating whether or not I do chemo again or we'll wait and see. They're going to use a different type of chemo this time, which won't affect my fingers, and my hearing was affected too. I now have hearing aids, which is another new phenomenon. But basically what happened, men lose a high range frequency of hearing. This exacerbated it for me. So I'm probably 20 years further along now with my hearing loss, which I've adapted to. So going back to the idea of cancer, treatment is, my next option is going to be chemo if I do it. They won't do surgery because of the placement of the spots, and they don't want to do radiation because of the placement, again, of the spots close to the heart and lung. At this point, we're sort of choosing quality of life over being knocked out for chemo. The other side of that too is, in frank discussion with the doctors, is chemo works better when the cancer is really booming along. At the moment, the cancers are extremely slow growing. And almost like prostate cancer, if you do a little research on it, you'll find out that some people are more likely to die of old age before the prostate cancer becomes the issue that they would die from. But in my case, it's a small 4 spots in my lung. We check every time now, every 4 months, to see if it's expanding anywhere else, or if it's just the same 4 spots and how fast they're growing. Typically, I suppose we're all a little bit like this. You get this feeling of hypochondria, where if I get a pain in my chest, it's like, is it happening now? Or if I'm short of breath, I'm thinking, is that because of the spots? Like, is it growing to a big tumor? Is it you know, an impact? Does it have an impact? Classically, they have to be 8 milliliters in, 8 milliliters in length. 8 millimeters in length. Has to be one of those things. Before they can do an autopsy, or in size, before they can actually not do an autopsy, do I call this chemo brain. I can remember it, but I can't speak it. I can't spit it out.
Biopsy.
Biopsy, that's it. So it has to be a certain size before they can actually go in and do a biopsy where they would go in through my lungs. At this point, we're just approaching that level. And the question is whether or not we should go with it or hope that nothing's going to happen. Options are the cancer could stop. It could encapsulate. It could metastasize to other parts of my body, like my kidneys, my liver, my spine, places like that. And at that point, it's pretty sure that we'd be looking at chemo as an option. Amazingly enough, it's been almost a year now, and we're still dealing with the same spots. So I have my hopes up. It's interesting to suddenly realize that your life can be finite. I don't know if I'm going to live for another 6 months, another 5 years, another 10 years. Hard to say. But it changes your perspective on things. Things that were important to you before aren't quite as important. I'm still dealing with the recovery from treatment as well. And you might think that's kind of odd, but 2 years ago was treatment. Now, well, I'll say 2.5 years ago. Now I'm still recovering from the effects of chemo, the damage that was done by radiation. And sometimes some people might say that treatment's just as dangerous as the disease, except that it's given me some options for life. It also allows me to look at life differently and do what I want to do. It allows me to talk to people and share my feelings, share my experience, because everybody's been touched by cancer. Everybody's had an uncle, a brother, a sister, a mother, a father, or themselves. Everybody deals with cancer differently, but you know, they can't tell you everything about cancer. And they can't tell you about those days where you don't have the energy because the chemo knocked it out of you. They can't share because they haven't gone through the fact that some days when you get up, you just want to sit there and stare. And if the phone rings, you kind of look at it and go, oh, the phone's ringing. It doesn't really prepare you. All those workshops and events that take place before the treatment doesn't prepare you for what really happens. And you don't remember either. I mean, you can take all those notes, but all that stuff that they're telling you about is like information overload. So once you've lived it, it becomes quite different. So for me to share what's happened makes a big difference. To share with other people, it's therapeutic for me. Otherwise, I'd be sitting here thinking and stewing and wondering what's going to happen next. Now I can feel a little bit of hope that I'm at least shedding some light on someone else's life. And there's positives and negatives. I've met a lot of people along the way. I have a group of friends that I've stayed with, that I encounter. I'm a little bit shy sometimes about talking now. I mean, I used to talk to groups. I used to talk to students. I used to talk to people. That was part of my life, my job. Now I'm a little bit more self-conscious about my throat, my voice, being able to project, being able to hear. Sometimes the worst is sitting in a restaurant where the overhead noise is so loud I can't really get my voice across because no one can hear what I'm saying. So maybe I can help by, you can hear what I'm saying right now. That's pretty much all I can tell you. And hopefully I'll be around to tell you another story later.